Bienvenue à TVC-TK et mon invité aujourd'hui, c'est David McLaren. David, bonjour.
Bonjour Madeleine.
Ça va bien?
Ah, ça va très bien. Il y a une belle grosse foule, ça va très bien.
Bon, c'est bien. Premièrement, on va commencer avec, c'est quoi votre rôle ici à Kebaowek?
Bon, je suis directeur des services de santé, puis aujourd'hui, c'est notre journée de foire de santé, où est-ce que tous les employés et partenaires qui nous aident à améliorer la santé de nos gens se regroupent pour justement promouvoir des trucs ou des choses au niveau de chaque département qu'ils font.
Fait que là, chaque département ici qui travaille pour le centre de santé sont présents.
Absolument. Puis en plus de ça, on a invité des partenaires comme Neighbors, qui est un partenaire qui nous aide à acheminer, mais il nous supporte quand on a des visites dans des hôpitaux francophones, surtout à Rouyn-Noranda. Il aide nos gens qui sont unilingues. Fait que c'est très bien. On est les gens du CISAT qui est ici, qui nous parlent un peu des processus de plainte, des choses comme ça. On a aussi Emma Québec, qu'on va devenir un partenaire collaborateur justement pour ce qu'on appelle le dépistage. Ça me vient pas l'idée, là, mais genetics.
Génétique.
C'est ça. Fait que sont ici Emma Québec. Et on a ici les gens de la MRC, parce que la santé, c'est beaucoup plus que les hôpitaux et les cliniques. C'est aussi un déterminant de la santé, c'est le développement économique. On a les gens de la MRC, quelques maires de Ville-Marie, de Béarn, de Témiscamingue qui nous supportent dans notre projet Unimiki, notre projet de mini-centrale. Donc, on s'entend qu'un projet comme ça, c'est innovateur et ça pourrait nous aider à acquérir notre centre d'hébergement pour personnes aînées. C'est vraiment le projet qui nous a à cœur présentement.
Oh, c'est bien. Fait que là, la journée de la foire, qu'est-ce qui se passe durant cette journée? Ça a commencé à quelle heure?
On a commencé à 1h, puis ça devrait se terminer aux alentours de 7h. Évidemment, les gens ont une chance de visiter chaque département, chaque collaborateur pour aller chercher de l'information. Ils ramassent des billets de participation parce qu'il faut qu'il y ait une interaction. Ces billets de participation-là, c'est bon pour des tirages qu'on va faire plus tard. Et avec ça, il va y avoir quelques speeches à propos de la recherche et gestion de l'information, et aussi il va y avoir un speech sur la gouvernance. Ensuite, on va avoir un bon souper, évidemment un bon souper santé qui ressemble au printemps peut-être. Fait que ça ne sera pas rien qui va sortir de la friteuse aujourd'hui.
Bon. Fait que là, c'est quoi votre but de la journée comme ça?
C'est beaucoup de sensibilisation. Écoute, il y a des ateliers qui parlent de la fumée, qui parlent des drogues, alcool. Il y a des ateliers qui vont parler de la culture, de comment, parce que c'est un déterminant de la santé très important. Des ateliers qui vont parler de la santé mentale. Fait que c'est tous des petits trucs comme ça qu'on veut partager avec nos gens pour s'assurer qu'ils savent qu'est-ce qui se passe dans leur bâtisse qui leur appartient.
Bon. On va faire le tour. On va parler à les gens, puis on va présenter à la public qu'est-ce qui se passe ici à Kebaowek pour un foire, puis l'information qui se passe entre les entrevenants qui travaillent puis les gens de la communauté.
Absolument. Vous allez voir qu'il y a une belle diversité. Puis aussi, comme je vous dis, la santé, c'est plus large que les cliniques. C'est vraiment les aspects sociaux, le développement économique, l'accès au territoire. Ça, c'est des choses très importantes. Et vous allez voir, on a une équipe de la gestion des terres qui sont ici. C'est important parce que pour nous, pas de territoire, c'est des problèmes de santé mentale. Merci.
Fait que tout le monde qui est ici joue un rôle dans la santé.
Absolument.
Bien, merci beaucoup, David.
Merci.
Welcome to TVCTK, and today my guest here is David McLaren. Hi, David.
Hi, how are you doing, Madeleine?
I'm doing very good. So there's lots of things happening behind us. So we're actually at the Dome in Kebaowek. So can you tell us or explain to us what's happening today?
Well, every year for the last perhaps 10 years, we've been doing what we call a spring fair. and a health fair, obviously, to kind of showcase our community members the work that we do in health prevention and promotion. And as the years went by, we've started to add some partners who help us in our journey to have a healthier community. So this year we've had a few extra new people join us, and we're very excited to have them.
Okay, very good. So we have a lot of booths here. So I think what we'll do is go around, if that's okay, and just...
I would recommend, I just want to have a keynote in regards to, for example, Emma Quebec, who is here with us today. The CISAT is here with us today. We have the people from the Health Commission who are here today. Again, the MRC who is supporting, who are partnered with us in the Onamiki project. They're here today with a few mayors from Ville-Marie, Béarn, Témiscamingue. So we're very pleased to have these people here. We also have a new group called Neighbors who help us, our people who transient to the community, to the hospitals in Rouyn-Noranda. They're an English-speaking service, so if our members have to go to Rouyn-Noranda and they're surrounded, a little overwhelmed with the French, and they have some issues with the language, there's a group there who will help us out and navigate the system there. Wow. So make sure and visit all our booths, and thank you for coming.
Okay, well, what is your main goal, though, for today? I know you said it's to give, like, you know, the community, like, what you're doing in work, but at the end of the day?
Well, at the end of the day, there's a trick to it, okay? We're kind of a sneaky on this. We also... It's about promotion. For example, you'll see a booth in regards to smoking cessation. We want to be able to reach lots of people and inform them about, you know, the benefits of quitting smoking. We're doing screening. A big important thing too is we get to do screening. So we detect, for example, levels of the lipids, the cholesterol, the sugar levels, and the blood pressure. So every once in a while we'll get a few flags, and we'll make sure it's followed up with their doctor. And it's a health fair, but it's also a benefit for the people to get together, to talk, to reminisce, and get to know what we do.
So we see behind us some people are actually sitting down talking right now. They probably did the visit to booths. So what are other activities that's included in the fair?
Well, we're going to have two presentations. One's going to be on research and data. It is a very dry subject often in our communities that we have to canvass our community in regards to whether it be for economics reasons, for health reasons, for social reasons. We do research and studies and surveys, and it's not always easy, and I do appreciate our members who do participate. It helps us at a deciding level to adjust our programming, our orientation, our health plans accordingly. So they're going to give a little speech about why they do that, because they've heard it from me, but I like the people who actually do it will present it. Also, I'm going to talk a little bit about our new health project in governance. So the First Nations people are moving forward in a governance in their own health. So it's another little thing we're going to pass on.
Okay. So, and then it ends with a supper tonight, right?
Yes, obviously it's a health fair, so we try to keep it as healthy as we can. It doesn't mean that someday we're not going to go back to some good old fried bannock and fried something, but it's not it for today.
Not in fried today. So, and at the end of the meal, you also have draws, right?
Well, it's a caveat. I mean, people, came down here. They listened to our spiel. Our speech is about health prevention promotion, and we've decided, and it helps to get some population here. But there's some cool draws. A lot of it has to do with the outdoors, getting our people outdoors and whatnot. So we'll be having some draws at the end of the evening.
Okay, well, we wish you the best of luck with the fair this year, and thank you again, David.
Thank you very much.
First booth today is with, I'm not sure which booth this is, but it's called First Line. So I have First Liners Stacy McBride.
Hi.
And Darlene McLaren.
Hi.
So can you, I don't know which one of you wanted to explain to me what is First Line for kebaowek?
So, okay. So First Line Services is about reducing child placement in the kebaowek community. So how we do it is we do it through preventative services. So what we do is we offer a variety of different programs available in the community on a daily, weekly, monthly, and we try to incorporate the whole community, so 0 to 99. So by looking at our posters, we have a women's paint nights, so that's for the women, and then we have community breakfasts, and that's to get families together to be able to give more information about nutrition, about getting the family together. We have themes of the month through the health center, so we try to touch base on different topics. And we also give out questionnaires and evaluations so that we can make sure that our programming is in line with the needs of the community. So we do that through, we have elder support services, we have child and family services, as well as we have youth. So we try to really incorporate everybody because we know that in the community it takes a whole community to raise a child or to be a part of the family. So through creating these relationships with different age categories, we're able to better serve the community.
Okay, so I'm going to pick on Darlene now. So can you explain to us what do you have here on display and why is it out?
What we have on display here is advertisements for our upcoming programs and activities such as the Lunch Fit, the Community Breakfast, Community Kitchen, the Women Paint Night, as well as our Meals on Wheels program, which is dedicated for the seniors, and which occurs twice a month, as well as a psychologist that comes within the community twice a month, and also a job posting for the summer months. It's the educator for Camp Bear Hug. And also we have some sunglasses for kids, some shaker bottles for smoothies, and some pens, and as well as first aid kits and chapsticks, just to, give to the community members.
So that's what somebody would get if they stopped at your booth, right?
Yes. I fill up each bag with every one of them.
Okay.
As well as if they're seniors, I give them a questionnaire just for them to fill out to see how we're doing as program workers and if we're missing anything, or just to touch base and see how things are going, as well as for children and families.
Okay, so you get the input from everybody.
Yeah, it's important to make sure that we're on the right track and ways that we could improve our services.
Okay, well, I want to thank you and Stacy for taking the time to talk to us.
Thanks.
Avec moi, je vais vous laisser présenter.
Claire Bolduc, je suis la préfète de la MRC de Témiscamingue et je suis très contente d'être ici aujourd'hui.
Bon, vous êtes à kebaowek, la Première Nation. On est la salle communautaire. Puis, qu'est-ce que vous faites ici?
Je suis venue avec l'équipe de Kebaowek et de Wolf Lake pour parler du projet qu'on mène, les 3 communautés ensemble, MRC les 2 communautés, sur Onimiki. Un projet de mini-centrale hydroélectrique au fil de l'eau, donc pas de barrage. On utilise la vitesse naturelle et le courant naturel de l'eau pour générer de l'électricité, pour se donner des moyens propres, non seulement pour avoir de l'électricité, mais aussi pour avoir un projet qui nous rassemble et qui nous donne des moyens financiers et des moyens de travailler ensemble pour construire notre territoire. Les moyens financiers qui seront certainement des revenus très appréciés dans les 2 communautés.
Fait que ça fait combien de temps que vous travaillez avec les 2 communautés autochtones?
Moi, c'est depuis mon élection qu'on a commencé à travailler sur le projet. Dès l'élection, on a commencé à travailler dessus. Mais ce projet-là est dans les cartons et du travail qui se fait de la MRC et des communautés. Ça fait une dizaine d'années, certainement. Et c'est un projet qu'on souhaite voir aller de l'avant maintenant. On veut que ça marche, que ça fonctionne, que ce soit un projet qu'on construise et qu'on aille de l'avant. C'est un projet porteur. D'abord, c'est un projet où on co-construit. Donc, c'est un projet de contact entre les communautés. C'est un projet qui nous donne des moyens. C'est un projet qui nous donne de l'électricité aussi dans notre territoire. On n'est pas en surplus d'électricité ici. C'est un beau projet pour ça.
Fait que là, c'est quoi? Vous êtes rendu où dans le projet?
Actuellement, on est à l'étape de faire la demande au ministère des Ressources naturelles sur les droits hydriques. À partir du moment où le ministère nous dit « vous avez le droit d'utiliser le cours d'eau ici pour un projet de mini-centrale », on construit le projet et on fait les contrats avec Hydro-Québec pour la vente d'électricité parce que nous, on ne peut que produire l'électricité. Au Québec, c'est Hydro-Québec qui vend toute l'électricité. C'est comme ça aussi ailleurs, mais au Québec, on passe par Hydro-Québec.
Fait que là, est-ce que vous avez une date en tête quand le projet va débuter?
Le plus tôt possible. Là, on est en demande et on est en demande auprès du gouvernement Et c'est les discussions, c'est très politique, alors c'est les discussions qu'on a avec les différentes parties du gouvernement pour obtenir les droits hydriques.
Bon, ben je te souhaite un bon succès avec le projet. Ça fait longtemps, puis on espère.
C'est un projet qui va être bon, qui va être porteur pour tout le monde, pour les communautés de Kebaowek et de Wolf Lake, pour les gens de la MRC, pour les municipalités de Kipawa et pour la ville de Témiscamingue. C'est un beau projet pour tout le monde.
Fait que là, tu parles de les trois, puis là, j'ai une question qui vient en tête, là. Comment que le MRC puis les deux communautés vont comme profiter de ce projet?
On a déjà, nos discussions nous amènent déjà à dire, on construit le projet. Donc, c'est nous qui sommes les promoteurs. On construit le projet. Les bénéfices qui sont retirés du projet sont partagés entre les communautés et la MRC à part égale.
Bon, c'est un bon projet pour notre région.
Absolument. Ah oui, tout à fait. C'est un très beau projet pour la région. C'est un beau projet pour le territoire du Témiscamingue. Oui, tout à fait.
Bon, merci de prendre le temps de nous parler.
Merci.
Welcome, and I have a guest here that I will let her present herself.
My name is Claire Bolduc, and I am the préfet de la MRC de Témiscamingue, the mayor with the mayor.
Yeah. The boss of the mayors, sort of.
Not really the boss. I'm a leader with the mayors.
So you're here in Kebaowek for the spring fair, or the health fair, we call it. And what are you? Do you have a booth here?
Yes, I am with David McLaren, and we have a booth to talk about the Onimiki project. Hydroelectric project to build a project with the community, the MRC and Kebaowek and Wolf Lake, to produce electricity and to have our own project with our own benefits.
Okay, so you're in partnership. So whereabouts are you in the project?
We're at the point that we ask for the water rights. The water rights are the authorization from the government to use the water to produce electricity. So we are at that point now. It's a political point. We have to ask that to the government. And when we will get those water rights, we will have the authority to discuss with Hydro-Québec to sell the electricity we can produce with that project.
So this project, is it going to benefit the MRC and the two First Nations, like financially, and which way?
It's a good project. No environmental problems or small environmental problems. No big issues about that. It's a project that will give us some benefits. We will build the project and we will run the project together, and then the benefits will be shared between the two communities and the MRC, half and half. Okay. So it's a very good project. We will have some own funds to build other projects, to make economic projects, development projects, healthcare projects, school projects for all our communities. It's a very good project, but it's a project to build together. We have to build it together, to work on it together, and we are really proud to work with Kebaowek and Wolf Lake on that project.
Well, it's a very good project. So do you have like a date of when this is going to start?
As soon as we can get the water rights, and we are actually on discussion with the government to get those water rights.
Well, I think that's hopefully come soon, and it's a very good project, not just for Kebaowek and Wolf Lake and the MRC, but our whole region.
The whole Témiscamingue will benefit on a project like that, and the community of Kipawa, the city of Témiscamingue, they will share the benefits, but all the Témiscamingue will profit of all the benefits we can get. And thinking that there is no big environmental issues, thinking that we need electricity in all the Témiscamingue, it is a good project for all of us.
Yeah. Well, I wish you very good luck with the project, and I want to thank you for taking time to talk to us.
Thank you very much.
Okay, we're at another booth here at the fair, and I am with
Kayla Lariviere.
Welcome, Kayla.
Thank you.
So tell me, what is your role here in Kebaowek?
So I work for First Line Services Department under the Kebaowek Health and Wellness Center as the youth worker. So every week I host a youth night for our local youth. Then we do things like cooking, have movie nights, have workshops, guest speakers, all kinds of things like that. In the summer we have it more frequently, when the kids have more time.
So, what do you have here at your booth today?
Okay, so I have some self-esteem activities for the teens. There's a couple activities in there that they could do. I have the sign-up sheet for our youth nights, and if people want to know what we do, then I explain to them, and then we have some resources that people can access at our office.
So I guess your goal here is to actually get some youth's name on your little sheet there, I guess.
Hopefully get some more than what we have now, so that's the goal.
Well, thank you very much, Kayla.
Thank you.
Okay, so my guest here at this booth is...
Vicky Consta.
Hi, Vicky, how are you?
I'm good. How are you?
I'm good. So what is your booth called? What do you represent here?
Okay, my booth is for wellness and addictions at the Kebaowek Health Center. So today we're displaying some of the ingredients that are found in cigarettes. There's 599 ingredients found in cigarettes, and these are just some of them. So we're putting them on display for people to be aware of what is in a cigarette.
Wow, so I see a gas can, so that means there's gas in it?
Yes.
Wow. So all this stuff is found in cigarettes. So for those viewers out there, every time you take a smoke, you're inhaling some of this. That's just incredible, isn't it?
Oh yes, it is. It's kind of scary actually.
So what is your goal for today here at the fair?
The goal for today is to bring awareness about the smoking, because we're focusing our theme on smoking on this table, and to promote our smoking cessation program that we have here in Kebaowek. It's to help people that want to quit smoking. So we work with the nurse. I work with the nurse in Kebaowek, and we work with the pharmacy in Temiskaming to get them on the patch and stuff like that to help them.
Okay, well, that's really good program. So is there any message you want to share with someone that might be watching this program?
I just, not really. I just want to say that, if you want to quit smoking, or if you really want to try, it's worth a try. Sometimes it takes many times to be successful at quitting, but don't give up. It's possible. Anything's possible, and just keep trying.
Because your overall health matters, right?
It sure does.
Thanks, Vicky.
Thank you.
Bonjour, avec moi, c'est Jessie. Jessie,
Bonjour.
ça va bien?
Oui, ça va bien, vous?
Fait que là, ben là, il y a Jessie, il y a aussi
Julia Wabi.
Julia Wabi, elle travaille avec toute cette gang ici. Puis j'ai aussi...
Tyre Perrier.
Bon, ça c'est les trois qui travaillent pour Wolf Lake, c'est ça?
Oui, c'est exactement ça.
Fait que là, vous êtes ici au foire à Kebaowek, puis peux-tu nous expliquer qu'est-ce que vous avez comme présentation aujourd'hui?
Alors, dans le fond, nous, on est ici pour promouvoir les services qu'on offre présentement, puis de savoir si ça va être quoi les services que notre communauté a besoin. Alors, on montre aux gens que présentement, on a notre NADAP worker, qui est moi, qui travaille en toxicomanie. Alors, si quelqu'un a besoin de l'aide, il peut venir nous voir. On a notre cultural rep, dans le fond, qui nous aide avec toute notre programmation culturelle. On a aussi notre étudiante là, qui nous aide pour l'été. On a aussi, dans le fond, le Healthy Living. Alors, on essaie de vraiment promouvoir l'activité physique, bien manger, avoir un esprit sain, vraiment, dans le fond, quand on pense à les quatre sphères de la Medicine Wheel, on essaie vraiment de suivre ça puis de promouvoir tous ces aspects-là, puis trouver un ballon là-dedans.
Bon, fait que là, aujourd'hui, vous voulez accomplir exactement quoi d'être ici à Kebaowek?
C'est vraiment de montrer aux gens c'est quoi nos services, de savoir que justement ces services-là sont offerts. Puis en même temps, on aimerait ça savoir c'est quoi les autres services qu'ils aimeraient voir sortir de notre département.
Fait que vous travaillez beaucoup avec Kebaowek Première Nation?
Oui, on essaie de faire beaucoup de collaborations quand on peut. Là.
C'est bien, c'est super. Ben merci Jessie, puis merci les filles.
Miigwech, merci.
Okay, so we're here at another booth at the fair, and my guest here is
Jessie Bond.
So Jessie, and we have also
Julia Wabi.
hi Julia and
Tyre Perrier.
Tyra. She was trying to hide, but I caught her anyway. So Jessie, you're here representing what?
I'm here representing Wolf Lake, our Health and Wellness Center.
Okay, so what do you have on display at your booth here?
So right now we're kind of like starting off with our health and social services. We have what is available right now. So right now we do have wellness and addiction services that are available. We also have cultural services that our new cultural rep is helping us with. So Julia is helping with that. And Tyra is contributing to all of this through being our summer student. We also have healthy living, so we promote physical activity, healthy eating, and all that. So I think that pretty much sums it all up for now.
So what's your goal for being here today?
Well, our goal is just to let people know that the services are out there, because as much as we're trying to get the services known through our Facebook page, our web page, through our newsletters, not everyone is always knowing that these services are there. So we're here just to kind of let them know we're here and that we're able to service them, and kind of wanting to find out what other health and social services that they'd be wanting from us.
Okay, well, I want to thank you for taking the time to talk to us.
Miigwech.
Okay, so we're here with, actually, this is my daughter, for those of you that don't know her, and I'll let you say, present yourself.
Okay. Hi, my name is Lynn Grand-Lewis, and I am the Maternal Child Health and Head Start Program Worker.
So, Lynn, you have a table here with lots of things. So, can you explain to us, like, what's out here on your table?
Okay. I have some information about child development and nutrition, and I have storybooks because I really would like parents to read to children, and it's very important. I have a little bit of stuff that I work with the kids, so I do a little bit of culture. So we have beads and leather and key rings to make keychains. I have what we call wiki sticks and the cards with letters, so that's one of the tools I use to teach letters. And then I have just some fun toys for the kids to play with, because learning through play is the best way.
Okay, so can you give us an example of how you use this, what do you call that thing?
Wiki sticks.
Wiki stick.
Yeah.
How do you use a wiki stick?
So wiki sticks, they look sticky, but they're not on your hands, and you can put them together, and we use them on cards here. And we practice doing letters, so we're going to practice V, and then we make the V with the wiki sticks, just like that. Some other people were trying them out. It's good for all ages, but the kids love it, and then they can just create what they want with them too.
Okay. So what is your goal for today to have a booth here?
Just to give more information to our community and the public of what I do and how important it is to work with children and give the children the tools and stuff to do the best they can in their development.
Well, thank you very much, Lynn.
Thank you.
Okay, so now we're at another booth here, and my guest here is Donna Perizzo.
Hi.
So can you just explain to us, like, what is your role with kebaowek and why you have a booth here?
So I'm the coordinator of Jordan's Principal. It's an access for 0 to 18. Any services that they need medical-wise, we find funding and transportation and anything else.
Okay, so I'm just going to back you up a little bit. So Jordan's Principal, for people that don't know, how did this come to be, why we have something called Jordan's Principal now?
So it was a little boy in Manitoba. His name was Jordan River Anderson. He was born with many difficulties, so he was in the hospital for 3 years, I believe. The federal and provincial government fought to decide on who would pay for him to go home. They fought and fought and fought, and the little guy never got to go home.
So the reason they were fighting is because he wasn't near the city where he was in the hospital, right?
That's right. So they came up with the Jordan's Principal law across Canada to help every status child.
Because what happened to Jordan is he never made it home because he passed away because of the fight that was happening with the provincial and the federal government. So now we have Jordan's Principal that's here to
service all of our children, help them with any medical services that they need. Out of province, English speaking, just help them get to where they need, to what they need.
And it's not just for health though, is it?
No, we have all kinds of things. There's educational side, health side, assessments of all kinds, so all of that.
Okay. So what's your goal today having a booth here?
Just to make awareness to everyone and to let them know that it's available and what we can do for them.
Okay, so I'm pretty sure this is pretty wide open what you can do, right?
Absolutely. Anything is possible.
Just have to request it.
Yeah, yeah. Medical is anything medical. Yeah.
Okay. So for those of you that learned something, this is Jordan's principal, and I want to thank you, Donna, for taking time to talk to us.
Thank you.
Bon, bonjour, avec moi, c'est...
Jonathan Leclerc.
Bonjour, Jonathan, et...
Et Marc-André Bonneau.
Bon, vous êtes où?
Bien, je travaille pour la Commission de la santé et des services sociaux des Premières Nations du Québec et du Labrador. Puis, on est basé à Wendake, spécifiquement.
Okay, ça, c'est à Québec. Fait que ça, c'est... et vous travaillez dans le même bureau?
Oui, les deux, on travaille au secteur de la recherche. Puis aujourd'hui, on vient présenter l'enquête régionale sur la santé. C'est une enquête qu'on fait depuis 1994. Puis donc, c'est ça, la communauté a participé à cette enquête-là. Donc, on vient redonner l'information, présenter les résultats à la population.
Fait qu'est-ce que vous pouvez expliquer comment ça marche quand vous êtes ici pour présenter? Mais qu'est-ce qui a eu lieu avant ça? C'est qui veut répondre?
Je peux commencer.
OK.
Peut-être que Marc-André pourra continuer. On va se partager la réponse. Mais dans le fond, dans un premier temps, quand on invite les communautés à participer qui sont libres d'accepter ou non, et une fois que les communautés acceptent de participer, on recrute des intervieweurs dans les communautés. Ce sont les membres des communautés qui font les entrevues. Ça permet d'offrir des contrats de travail dans les communautés. On vient les former. Et là, bien, les questionnaires doivent être administrés aux personnes vivant dans les communautés. Donc, ce sont ces intervieweurs-là qui sont responsables de cet aspect-là. Une fois que tous les questionnaires sont complétés, comme les questionnaires sont électroniques, c'est downloadé dans notre serveur. Et nous, à ce moment-là, bien, il y a tout un nettoyage, là, sans entrer dans les détails techniques, mais on fait un nettoyage, puis après ça, on fait une analyse pour rendre l'information intelligible, pour la rendre plus facile à comprendre aux gens. Et on produit un rapport régional et des portraits communautaires pour les communautés participantes.
Bon. Fait que là, le but d'être ici aujourd'hui, c'est quoi?
C'est vraiment de redonner l'information. Aussi, pour nous, c'est un moment précieux parce qu'on est toujours content d'aller dans des communautés, de rencontrer les gens, de mieux comprendre aussi la réalité de chacune des communautés qui est unique. On a un rôle aussi qui est de développer les questionnaires en partie. On travaille avec d'autres organisations des Premières Nations. Donc, notre premier objectif aujourd'hui, c'est de redonner l'information, mais aussi de rencontrer les gens, de jaser pour mieux comprendre justement c'est quoi les besoins en termes d'information.
Bien, merci beaucoup d'avoir pris le temps de nous parler.
Merci à vous.
Merci.
Okay, so here I'm at another booth and there's lots of paperwork. So first of all, I don't know who you are. So what's your name?
I'm Jonathan Leclerc, and I work for the First Nation of Quebec and Labrador Health and Social Services Commission.
Okay, and you are?
I'm Marc-André Bonneau, and I'm also working at the Commission.
Okay, so you're working at the Commission. So for people that don't know, the Commission's in Quebec City, right?
Yeah, exactly. Based in Wendake, near Quebec City, exactly.
Okay, so why are you here in kebaowek?
Well, precisely, we're here to talk about some surveys that we are, because we're specifically working at the research sector at the Commission, and we're leading some projects, some population survey based on the health of the population and the employment education. The goal of these surveys is to just provide information to the health director, education director, and counselor or chief of the communities so that they could it could support their decisions and they could support their planning of the services based on the information. We have this information, we have a level that we can do a regional portrait of all the First Nation living on the territory, and we give back the information of the community to the people in the communities, so they have access on their own information. We don't own this information.
So maybe you can explain what do you have display here?
Well, these booklets present the regional health survey, the results of the regional health survey. They're all available on our website. So you can go on the website, csspnql.com for more information. And so this is the health survey, and we have a coming survey that is called the First Nation Labor and Employment Development Survey. So the objective is to collect information on labor and employment and give it back to the council for better decision making, as Jonathan said. So that's it. Yeah.
So your actual goal here today is to do what exactly?
What exactly is to share the information with the population. We have two specific goals because as we're working for the people of the communities, but we're based in Wendake, we don't have often the opportunity to come in the communities and talk with the people living in different communities. So it's quite interesting for us having the opportunity to link with the people and having more background information and what is going on in communities. And on the other hand, it's to explain because the participation of the communities, of the people living in the communities, is essential to this process. Without the answer of the people, you have no information for the directors of the community. So it's really important to explain to them what we and the communities are doing with these information so that they know that, well, they're going to have maybe a phone or they're going to receive the visit from one of our interviewer and they know why they might have to answer the questionnaire.
Okay, so you're not the ones doing the interviews, so obviously it's community members. So do the data come back to you and how does it work?
Yeah, we recruit interviewers from the community members. We train them. We come in the communities to train them, and then once the data collection is completed, we receive the data because it's based on the tablet, the questionnaire on tablets. It's electronic questionnaire. So they download the questionnaire in our server, and we do the analysis at the commission. And we're responsible of the security of these data so that nobody's have information specific to one or another community and individual. It is all anonymous and there's no danger for the people to share this information. So once we have cleaned the database and analyzes the information, we create a regional report and we create community report for each communities that have been participating.
Well, it's very interesting, and I'm glad you made a trip all the way to Kebaowek. It's a little bit far from Quebec City. Thank you.
Thank you.
Bon, bonjour. Avec moi, j'ai la coordonnatrice de transport médical.
Oui. Mon nom, c'est Priscilla Durocher, puis je suis coordonnatrice de transport médical pour la communauté de Kebaowek First Nation.
Puis votre rôle comme coordonnatrice, c'est quoi?
Moi, j'assiste les clients à aller à leurs rendez-vous médicaux. Fait qu'on fait de la transportation ici avec nos véhicules ou soit on fait des remboursements pour si les gens prennent leur véhicule eux-mêmes.
OK. Fait que qu'est-ce que vous avez sur votre table aujourd'hui ici?
Ici, j'ai de l'information sur le transport médical qu'on a ici dans notre communauté. Fait qu'on a 3 véhicules, j'ai des conducteurs, fait que il y a aussi les soins et services non assurés. On a mis de l'information là parce que les gens aussi vont venir me voir s'ils ont besoin de l'aide avec l'accès pour leurs soins et services non assurés.
Fait que là, votre but aujourd'hui, c'est quoi?
C'est juste pour être ici puis mettre une face à mon nom puis dire, c'est ça notre programme puis c'est ça nos services.
Bon, ben merci beaucoup.
OK, merci.
So we're here at Medical Transportation booth. So first of all, I'd like for you to present yourself to us.
Okay, my name is Priscilla Durocher, and I'm the Medical Transportation Coordinator for Kebaowek First Nation. And I assist people accessing their medical trips, either by organizing their medical transportation with our vehicles or helping them with reimbursements. And I also help our band members access their non-insured health benefits, so whether it be vision, pharmacy, medical supplies and equipment, I may be missing a few, but other benefits. And that's pretty much it.
Okay, so you have a booth here. So what do you have on display?
I have on display some of my our vehicles that we have and our contact information, some non-insured health benefits information, and some pamphlets and a lot of forms. So any forms that we need for reimbursements.
Okay, so what's your goal today to be here?
The goal is to just to show what we have to offer and to put a face, a name to a face, and make sure that everybody's on the same page and know who to call when they need help.
Okay, well, I want to thank you, Priscilla.
Thank you.
Okay, so I am at Rodney's booth. So first of all, I'd like you to present yourself to our viewers.
I am. It's nice to be here. Nice to be with you. My name is Rodney. I'm a member of Kebaowek First Nation. I've been raised around the community throughout my life, and just recently I rejoined the health center team to promote and to work with culture, and hopefully I could do a good job.
I'm sure you'll do a good job, no doubt about that. So let's talk about culture. So what is it that you actually focus on in the culture?
The thing about culture, it's all it's really unique. So everything is integrated together with the language. So my first steps as a cultural worker is to organize language and present opportunities for more language development of who we are as Algonquin, as Anishinaabe people. So to make it fun and interesting, there's ceremonial approaches to the language and with the culture, giving respects of who we are as people is very important. Skill building, making stuff in the bush like snowshoes or canoes or paddles will be a fun for people to participate in. So I'm looking forward to presenting that nice opportunity for language and skill development.
So you have your table here. So what exactly do you have here? I see a book. Can you explain what this is?
Yeah, that's a book of introduction to the language. It's developed from different Algonquin communities around the Quebec region. So I think there's 10 Algonquin communities. So people from different communities that want to preserve the language. So they got together and they discussed different projects to get language material out for people to know. So this is one of the books that was presented from the language committees, which the central point is from Kikigan Zibi. So it's nice to share that knowing of the language.
Okay, so what is your goal today being at the fair?
My goal today? Yeah. My goal today is to introduce myself as the newest member on the health center staff, to highlight culture and Tobacco Road. So on the Tobacco Road, it's a hard road to travel, but it's definitely worth the trip. It's about understanding that there's no right and no wrong answers. It's you of what you want in your life at that time. So the Tobacco Road is a practice with a ceremonial approach of understanding of who you are. So that's what I kind of like to get out of today and the rest of the days.
Okay, well, miigwech.
Miigwech, yes, nice to be back.
OK, bienvenue et je suis à une autre présentation ici à la foire de Kebaowek. Et vous êtes qui?
Et moi, je suis Jessica Nestorok.
Bonjour Jessica, bienvenue.
Merci.
Bon, peux-tu nous expliquer c'est quoi votre table puis les services que vous offrez ici aujourd'hui?
Oui, donc moi, je suis ici avec Neighbors, qui est l'association pour les anglophones de Rouyn-Noranda. Donc, nous, on a deux projets. Un, c'est l'agente de langue anglaise, qui est moi. Et dans le fond, moi, j'aide les gens à se repérer dans le système de santé et aussi avec la traduction. Donc, à leur rendez-vous, faire sûr que le client comprenne et le professionnel de santé aussi. Et on a aussi ma collègue Nathalie, qui est la coordonnatrice de santé. Elle est ici avec McGill. Et dans le fond, nous, on donne des bourses de 1 500 $ jusqu'à 10 000 $. Donc, il faut vraiment étudier soit en santé ou en services sociaux. Et dans le fond, le point de ça, c'est pour faire sûr qu'on a des professionnels de santé bilingues. Donc, faire sûr qu'ils vont revenir ici dans la région et que, tu sais, on peut avoir des services dans le fond, dans notre langue.
Est-ce que les bourses sont-tu juste pour les Premières Nations?
Non, dans le fond, n'importe qui, n'importe quel âge même, tant que tu étudies en service de santé, services sociaux, c'est correct.
Bon, c'est très bien, ça. Fait que là, vous avez des documents, des choses sur la table. C'est quoi exactement?
Oui, bien dans le fond, on a comme pour mon projet, on a des pamphlets, des stylos, même un petit passeport de santé. Puis c'est vraiment pour inscrire l'information des médicaments, des allergies. Il y a même des petites phrases qu'on a traduites. Tu sais, des petites phrases que tu pourrais dire « Ah, j'ai mal », bien c'est quoi en anglais ou vice-versa. Puis aussi pour McGill, on a des bouteilles d'eau, puis toutes des informations sur quel cégep offre tel programme, l'information sur ce programme-là, puis sur les bourses aussi, puis comment appliquer, etc.
Bon, est-ce que vous êtes contente les gens qui ont arrêté à votre table aujourd'hui?
Ah, je suis très contente. C'était une journée formidable. Moi, j'ai même fait des rendez-vous, donc c'est sûr pour moi, c'est un succès.
Bon, bien, merci beaucoup et bonne chance.
Merci.
Okay, so I'm at your booth now. Can you explain to me what your booth is?
All right, so there's kind of like two parts of our booth. So we're from an organization called Neighbors, and it's the Regional Association of Rwanda. And so basically my part of the project is I'm kind of like in partnership with the hospital in Rwanda. And I'm the English Health Service Agent. So what I do is I accompany people at the hospital. So, you know, we want to make sure that the patient understands and also the healthcare professional. So anything that comes with translation or even navigating the healthcare system, you know, signs are in French, you might not know where to go. I'm here to definitely help with that. And then you have my colleague, Natalie. She's here for Neighbors, who's also in partnership with McGill. And we give out bursaries for anyone who's studying in the health and social services. So if you're nursing, a medical secretary, anything like that, you can apply for a bursary, and they run from like $1,500 to even $10,000. So if you're studying in anything like that, it's really good to apply for that. I mean, it's a big amount of money that can help you with your studies. And the point of that is because we want to make sure that we have bilingual healthcare professionals that stay in our region. So it's all Abitibi to Miskameng.
Wow, that's really an interesting project. So how did you come to know about our fair in kebaowek here?
Well, we're partners with the community center in that. So, and it's usually my colleagues who work a little more, but I've also been in contact with Priscilla, who does the medical transportations. So we are in contact a lot because, you know, she'll tell me, okay, someone's going to the hospital in Rouen, can you give them a hand?
So you assist them personally, when they get there?
Yes, I do.
Okay. So what do you have here on your table to give the public today?
Well, I did have some pamphlets, but I ran out, actually. Everyone jumped on them. But I also have a health passport. So that it's basically like, you know, you can almost fit it in your pocket. It's small. It has a place for you to write your medication, your allergies. And also there's a few key words that you would use in an emergency room, like I'm sore. Well, what is that in French? So we translated that just, you know, so it can kind of help out in case you're in a situation where, you know, you don't have someone who can help you translate. And then my business card, and as well as pens and these cute little folders here that are for cards. So you can
medical.
Medical cards, exactly.
Wow. So have you had a lot of visitors?
Yes, we have. I've actually made appointments as well. Wow. So it's definitely been a successful day for us.
So you achieved your goal for being here today?
Oh, definitely.
Well, I want to thank you for taking time to explain to us your booth and what your services are. And
you're very welcome. We're very happy to be here.
And good luck with the rest of the fair.
Thank you.
Bonjour les madames.
Bonjour.
Bon, vous êtes ici à kebaowek, mais je vais vous laisser vous présenter puis de nous expliquer la raison que vous êtes ici à kebaowek.
Bonjour, je m'appelle Christina Saillard. Je représente ici le réseau de la santé et des services sociaux, le réseau public, le CIS de l'Abitibi-Témiscamingue. Et aujourd'hui, on vient tenter d'expliquer aux gens comment réussir à accéder au réseau. On parle notamment Info Santé, Info Social avec le 811, option 1 et option 2. Et on leur donne un petit résumé du réseau de la santé en 4 pages. On le sait que des fois, c'est quand même compliqué pour les gens de savoir comment y accéder. Fait que si on est capable de le simplifier un petit peu et leur permettre de comprendre davantage comment y avoir accès, bien, on va avoir gagné notre journée aujourd'hui.
C'est très, très bon. Et vous?
Je Je m'appelle Josée Larivière, je suis directrice générale du Centre d'assistance d'accompagnement aux plaintes de l'Abitibi-Témiscamingue. On est un organisme communautaire qui assiste et accompagne les gens qui sont insatisfaits des services qu'ils ont reçus dans le réseau de la santé et des services sociaux. On les aide finalement dans la démarche de plainte. Et on est un organisme régional, donc on couvre tout le territoire de la région.
OK. Fait que là, si quelqu'un a un plainte, qu'est-ce qu'ils font? C'est quoi les démarches?
En fait, ils peuvent nous appeler directement à nos bureaux et nous, ce qu'on fait, c'est qu'on leur explique comment ça se passe, le processus de plainte, et on les accompagne dans la démarche, notamment dans la rédaction d'une lettre de plainte écrite, si c'est ce qu'ils souhaitent faire, et dans l'accompagnement dans des rencontres, s'il y a lieu. On fait le suivi des délais avec eux, parce qu'il peut y avoir des délais à respecter, et le suivi des conclusions aussi, donc du résultat de l'enquête. C'est ce qu'on fait avec eux.
OK. Est-ce que vous avez un numéro si quelqu'un veut appeler?
Oui, c'est un numéro sans frais, c'est le 1-877-767-2227.
Bon, bien merci. Et vous, madame?
Bonjour. Moi, je m'appelle Julie Thibault. Je travaille au bureau du commissaire aux plaintes et à la qualité des services. Donc, on fait l'examen des plaintes. On est indépendant du Centre intégré de santé. On s'assure que les droits des usagers qui sont inscrits dans la loi sont respectés. Donc, on fait des enquêtes à savoir est-ce que dans une situation X, est-ce que les différentes politiques, procédures qui devaient être respectées l'ont été? Si oui, très bien. Sinon, qu'est-ce qu'on peut faire pour améliorer? Donc, on va aller vers des recommandations pour toujours améliorer, toujours offrir un meilleur service.
Puis votre but aujourd'hui, c'était quoi?
Le but, c'est de toujours faire connaître. C'est quelque chose qu'il faut toujours nourrir, donc de rappeler aux gens qu'ils ont ce droit-là, qui n'est pas partout, qui n'est pas pour toutes les organisations. Donc, en santé, ils ont ce droit-là. C'est bien qu'ils s'en prévalent quand ils en ont le besoin. Donc, de rappeler quels sont les droits, qu'on est là, on peut recevoir les plaintes et on va aller vérifier, s'assurer que leurs droits sont respectés. Donc, de rappeler toujours ça.
Bon, est-ce que vous avez eu beaucoup de visiteurs?
Ça n'a pas arrêté. Ça n'a pas arrêté depuis 1 heure, là. Oui, c'est super.
Bon, c'est bien, puis je vous souhaite une très bonne journée.
Merci, à vous aussi. Merci beaucoup.
Okay, welcome. And I am here with 3 ladies who each have a separate role in the health system. So I'm going to start off with you. I'll get you to present yourself and explain to our viewers what you do.
Hi, my name is Christina Saw here. We are here to represent the health and social services, the public system, and we speak about the 811 option 1, option 2, and we give it a brief about the system because it's a tad complicated. So at least if we can simplify it for the people to understand what we do and how they can access the system, we're happy about it.
Okay, well, that's really good. So that's your goal for today.
Yes, that's my goal for today.
So my second lady is?
Josée Larivière, I'm the director of the Centre d'assistance d'accompagnement aux plaintes. It's a non-profit organization which is accompaniment for the people who are wanting to make a complaint following the services they received in the social and health services.
Okay, so if somebody wanted to if they had a complaint, how did they do that?
They simply call us. And we explain to them how does it work, and we can most of the time we help them to file a complaint, which is a written complaint. So we write for them a letter of complaint, and they sign it. It's their complaint, but we help them following all the stages of the steps exactly, and if they're not satisfied of the first level, which is the commissionery conclusion, we can help them with the second step.
Okay, so what would be the number that they call? Do you know offhand?
It's a toll-free number, 177. Sorry.
You could get your card, so.
Because the toll-free number is 177-767-2227, but the local number is 819-797-2433.
Okay, so what is your goal for today being here in kebaowek?
We want people to know that they can have assistance in the complaint process, that they are not alone in that, and they can be accompanied in all the region. So they can call us and we can help them on the phone, but we can also go and see them at their place to take the complaint.
Okay, well, I'll thank you very much. So I'll move on to the next one. I guess I'll have to squeeze in here. Hello, and who you are?
My name is Julie Thibault. I work for the Complaints Commissioner's Office, so I do the review of the complaints we receive from people who are not satisfied with the services they receive in either different services, public health system, social services, and we just look everything up, see if everything has been done right, if the rights have been indeed respected or not, and we do recommendations so that things change always for the better.
Well, that's good. And your goal today is what?
It's just to come and see the community here and always explain, because many people, we have to make a lot of publicity like this to make people aware of the services. So it's every occasion we have, we come, and especially a nice occasion to come to kebaowek like this.
So have you had a lot of visitors?
Yes, non-stop.
That's good. Well, thank you very much.
Welcome, okay.
OK, bienvenue. Je suis rendue à une autre table. Puis je vais vous laisser vous présenter.
Bonjour, je suis Nadia Baillargeon, je travaille chez Emma Québec. On est ici pour deux raisons principales aujourd'hui. Soit la prochaine collecte de sang à Lorrainville le 12 août, donc on invite les gens à les donner. Et il y a aussi un autre projet qu'on a commencé avec les Autochtones de kebaowek, qui est une étude de population pour mieux connaître leurs cellules souches. Les cellules souches, c'est en fait l'usine de fabrication de nos cellules fonctionnelles du sang, soit les globules rouges, les globules blancs, les plaquettes. Puis quand on a un problème au niveau de ces cellules-là, parfois il faut totalement les remplacer par une greffe de cellules souches. Et pour qu'une une greffe de cellules souches fonctionne, bien, on doit trouver un donneur qui est compatible, un match qu'on appelle. Et on va regarder dans la famille immédiate dans un premier temps, au niveau des frères et sœurs. Et s'il n'y a personne de compatible, on va regarder dans un registre international à ce moment-là. Rosalie, qui est une des receveuses et survivantes d'une greffe de cellules souches, elle est autochtone, elle vient de Wendake. Puis quand on a eu son cas chez nous, on n'avait pas de donneur disponible pour elle. Puis il y a eu d'autres cas aussi d'Autochtones qui ont eu cette même problématique-là, ce qui nous a poussé à faire une étude de population au niveau des Autochtones dans plusieurs communautés. Ça consiste à signer un consentement, donc comprendre le projet, donner quelques informations individuelles et faire un prélèvement avec un swab qu'on appelle, donc un Q-tip qu'on vient frotter à l'intérieur de la bouche.
Fait que peux-tu nous montrer ça?
C'est pas une prise de sang, c'est simplement un petit Q-tip. Il n'y a pas de douleur, il n'y a pas d'inconvénient.
Avec ça, tu es capable de prendre beaucoup d'informations.
C'est ça. On est capable de faire le typage HLA qu'on appelle. Donc, c'est les caractéristiques qu'on regarde lorsqu'on veut trouver un donneur compatible.
Wow! Fait que le but d'aujourd'hui, c'est quoi exact?
C'est que les gens puissent s'inscrire à l'étude de population, puis sachent aussi qu'il y a la collecte de sang qui s'en vienne. Dans le volet de cellules souches, en fait, si les gens sont entre 18 et 35 ans, ils peuvent aussi s'enregistrer pour devenir un donneur potentiel. Donc, ils deviennent, avec leur typage HLA, il est inscrit dans un registre. Ils ne peuvent être jamais appelés ou comme ils peuvent avoir l'occasion de sauver une vie à un moment donné dans leur vie jusqu'à l'âge de 65 ans.
Wow! Bien, en tout cas, c'est très intéressant. Puis, je vous souhaite une très bonne reste de la journée.
Merci à vous.
Welcome, and I'm here at another booth called Stem Cell Donor Registry. I'm not really sure if that's your booth's name, but first of all, would like to start off by, what is your name?
I'm Nadia Baillargeon, and I work at HEMA Quebec.
Okay, so what is HEMA doing in kebaowek?
So HEMA Quebec has two goals today. First goal is to promote the upcoming blood drive in Lorrainville on the 12th of August. So we present the blood donation and the process, and we introduce blood donation for people who doesn't know it. And also, we also just started a study population with the First Nation here in kebaowek. So basically, when First Nations are sick and they need stem cell transplant, we need to find a compatible donor. And to find it, we have better chance to do so if we look in first in the family and then in the same community. So there's two problems when the First Nation is sick and needs stem cell transplant. First, they are there are not much donor enrolled in the registry, so we don't have many donor available. And the second problem is that we don't know their typing yet. We don't have enough data to know where to look at when we need to find a donor. So that's what we're trying to do with the study population.
So the people that come to visit the booths today, are they like signing up for some of like this?
Yeah, so they can read the consent, the informed consent, and then some questionnaire just to have basic information about their community and their father and mother community. And then they do a swab. So it's on like a Q-tips that you press into your mouth. Okay. So it gathers some cells, and we have the data that we need to do the analysis.
So that's all they need to do is just a swab of the mouth to be part of the stem cell.
Yeah. So it took around 15 minutes, the whole process, read the 5 pages and complete the form and do the swabbing. And that's it, they can save a life.
Wow, isn't that interesting, eh?
Yeah. And there's also a third part, actually. The study population, anyone over 18 years old can participate. And if they are between 18 and 35, they can also have one more option to save life is to enroll to the donor registry. So if they are between 18 and 35, healthy and willing to donate to anyone, they can also enroll to the registry. It's the same process, only one more form to complete.
Wow, isn't that interesting? So your goal today was just to do what exactly?
To start the study population. The chief accepted today to our presence, so we will collaborate with them and to gather some data and some swabbing.
Well, I wish you good luck with this, and thank you very much for talking to us.
Thank you.
Welcome back, and I'm here with Chief Lance Heyman. Hi, Lance.
Good afternoon.
How are you?
I'm doing well. Yourself?
I'm good. So we're here at the Spring Fair. So what is the chief doing at Spring Fair?
Well, I'm here to support the various programs and services that are here, and also to highlight some of the projects that Chief and Council have prioritized, for our development, for the community development, which we hope will, contribute to us being in a position to do other projects. So today I'm here to support the programs and services, honor our Personality of the Year, and of course just to be here to show support and answer any questions that community members may have in regards to the Onomiki Hydro Project, our reserve enlargement, and of course what we could possibly do with the revenue generated if we were successful in having a project like Onomiki.
So we talked to Councillor David McLaren earlier and the Playfair. So they explained to us the project. So I'll just have you one question in regards to that. So with the money that would come in from this project, what do you see, or what does the First Nation here have in mind to do with that money?
Well, we would use it for community development and basically to fill in gaps where the current governments do not provide funding. So as you are aware, we have an aging population. We would very much like to start addressing their needs in terms of long-term care facilities and other services. And without own source revenue, we're going to be hard-pressed to do that. So with that revenue, we intend to build facilities for our elders and also look at what other needs are in the community. I think of sports facilities and other aspects that target other segments of our population, in particular our youth. And we could do many things. I think, it's endless for now, but Onomiki would give us own source revenue, and through, consultation with community, we would prioritize projects and be able to develop them without having to depend solely on government funding to do so.
That's really good, and the possibilities are endless when it comes to own source revenue, right? So we have a map here on the table. Can you explain to us what exactly is this map?
Well, as you know, that the federal government creates Indian reserves through legislation, and our reserve, when it was first created in 1972, was 21 hectares of land, which was, probably sufficient for the 100 or so members that we had in those days. In 1999, we started the process to expand the reserve, and we were successful, but it took 10 years. And what we were only successful in doing was acquiring enough land to meet residential needs. That was the policy for at the time under the additions to reserve. The policy's now changed that allows us to look at areas to expand the reserve that will allow for economic, social development, and a whole host of other activities. And it's not realistic for us to believe that we could do that all on our current land base. So we've submitted a project to Indian Affairs for reserve enlargement, which is pretty significant because it will take us from the current community, and if we're successful, the community will expand to about 8 miles by 12 miles long. We'll have a secondary access on the 101. And of course, we have to work with our 2 municipal partners because what the map delineates is the territory. So as you can see, this is our current reserve. This is land that is currently Municipality of Kipwa territory. And this is Municipality of Kipwa territory, Municipality of Temiskaming. So we've had meetings with both of those councils asking them to support our request for enlargement, and the discussions to date have been positive. So now next steps for us are to do environmental assessments, archaeological studies, all of the requirements that the department wants us to do. And we believe that with the support of the municipalities, we can acquire the reserve enlargement and the area that we've identified, hopefully within the next 18 to 24 months. And it will give us a land base that is similar to what municipalities have, and then we can look at, building our own, having our own gravel pit, secondary access out of the community. Given the recent flood that we had, which washed out the bottom of the road, really put it to the forefront the need for that secondary access. So that's a primary purpose, but it's economic, social development, and of course, because of the creation of Opemican Park, as you note, we've produced a map and a territory that would allow us direct connection to the territory, and the hope was that we would be able to get tourists who are visiting Opemican Park to come and visit the community and see what we have to offer in terms of services, our culture, and other initiatives that we're currently working on.
So there's a lot of development to occur in the next few years, I guess, with the expansion, and if you're looking at Opemican Park and stuff you want to do.
Absolutely. We know that the park is here. There's absolutely some job opportunities that our members are going to take advantage of. And now we want to be in the position to service the tourists who are going to come here. And we know that being Algonquin, being First Nation, we have a unique opportunity to highlight, our culture, our reality, and also to share in the handicraft and the other things that our members are doing, very well.
Okay. Well, thank you very much for taking time to talk to us.
You're very welcome. Thank you for the opportunity.
Okay, we are here at another booth, and this is a really big, long table, so it's probably a very busy one. So I am with Tina. Hi, Tina.
Hi.
How are you?
I'm very good, thanks.
So what is your role for that in Kebaowek First Nation Health Center?
So I'm the Community Wellness Programs Manager. I manage the prevention program team, which includes our Diabetes and Chronic Disease Coordinator, our Cultural Coordinator, our Sports and Leisure Coordinator, and our Addictions and Wellness Worker.
Okay, so we saw some of those coordinators back there when we passed. So we have some new faces here. So maybe you can explain to us what's happening at these stations here.
Okay, so first on this part, we're giving out the new divided plates for the New Canada Food Guide, which just came out recently this year. So we have a children's plate and an adult's plate, and Virginia has tear sheets that show the right portion sizes and what you should be eating. So that's a new strategy for us. Virginia is also taking appointments for our diabetic retinopathy clinics that we're going to be hosting very shortly in the next couple of weeks. That's where we screen for diabetic retinopathy at the health center.
Just going to cut you off. Sure. What is exactly retinopathy?
Okay, so diabetic retinopathy is the damage that's done to the eye for people living with diabetes, whether it's type 1 or type 2. Like other things that can be affected by high blood sugar, your eyes are one of them, and it affects the vessels in your eye. So we do screening here to make sure we can catch the damage as soon as possible.
Wow, and that's all done here in kebaowek at the health center?
Yes, it is. We have the camera. We're very fortunate to have a state-of-the-art camera. We've been trained, and this is our 10th year of doing screening.
Wow. So that's another thing you're doing, taking some appointments. And
we're also taking appointments. We host a women's health clinic here at the health center in coordination with the hospital. And what we do is we do pap screening for cervical cancer. So that's another thing Virginia is booking appointments for because they're going to be upcoming. And she's also booking appointments for our new initiative, which is our clinic with Dr. Schweitzer, who is a cardiologist specialist in Montreal, and we've been screening all eligible clients here in kebaowek First Nation in regards to heart health.
Wow, so there's a lot of screening going on here.
Yes, this is where we're using this opportunity because this is where we get to see the most people. Also, we have Jennifer, who's our receptionist at the health center, and she's actually taking names and appointments for our screenings that are going on behind me here, which is our screenings for cholesterol, blood pressure, and blood glucose. Sorry, I drew a blank. So we have the two nurses back here doing screenings all day, and so Jennifer's keeping track of that. And then we have Mitchell, who's on the end, our sports and leisure coordinator, and he's just helping keeping this organized, handing out the things for our dental hygienist program, which we have. And so they're manning this station.
Well, I knew it was a busy table.
Yeah, it is a very busy table. This is the hub of the health center, and the rest of our health programs are, like you say, are around the room.
Well, thank you very much, Tina, for taking the time to explain to us what's happening here.
Oh, you're welcome. Thank you for coming.
Okay, so I'm at another booth, and I'm going to let you present to our viewers your name and what you're doing here.
Okay, I'm Michaeli Jawbone. I work for kebaowek Land Management, and I have a shoreline restoration project on the Ottawa River. It's 3 years, and we're in our second year. And I'm basically looking for information on areas of erosion, damage, landslides, so that we can go there and restore those areas.
Okay, so you're working on this project for 2 years. Yeah. So are you taking information from like anybody that actually goes on the Ottawa?
Yeah, from everyone, local community, anyone who goes on the Ottawa River, I'd be happy to get their information.
Okay, so any viewer out there who goes on the Ottawa River listening to us, you can contact Michaeli if you have any information on any of the topics that she just mentioned. So how can they get in touch with you?
They can call me at work. I have a poster out. Do you want me to say my number?
Yeah.
Okay, so it's 819-627-3309, or you can email me at mjawbone@kebaowek.ca.
Okay, so your booth here today, what's your purpose today?
My purpose is to get information and to show the community the project that we're working on, and just to awareness of the project, basically.
And when do you think, when do you expect this project to be done?
It'll be done in 2021, the project itself, but we're going to continue to monitor after it's over because we're going to be doing water quality testing and it'll continue.
So the results that you're going to get from the people giving you information, so what are you going to do with that after?
We're going to make a report, and it's basically just a study, and it'll be like a baseline study, and it'll help us figure out, is the water quality better with the riparian buffer zones we're making, or is it not making a difference? Like, we're hoping it's going to improve.
Okay. Well, I think this is a really good project, and I hope you get a lot of feedback, and thank you. Okay.
Thank you.
Thank you. Well, welcome, and I'm at another booth, and hi, Casey.
Hi.
How are you?
I'm doing good. Busy, but good.
Good. Busy's good. So what do you do for kebaowek First Nation?
So I work on trying to find projects and bring them into the community, and just right now I'm focusing on trying to bring tradition back into kebaowek First Nation and to try and bring awareness to conservation and protection of our traditional land.
Okay, so what's the title of your booth here?
It is a moose research project.
Okay, so you're working on a project as well then?
Yeah. So my project is focusing on climate change and how it's affecting our traditional food as it's like leaving, so it's a security problem for us. And I'll be focusing it mostly on ticks and how they are affecting the moose.
Wow, interesting. So what's your goal today for having the booth here?
My goal is to just bring awareness, to ask for comments from the public to if they ever seen any moose, either doesn't have to be affected by ticks or not. Just I'm trying to get as much information I can from the public, from community members, trappers, hunters, non-community members, just any information about moose, I need it.
Okay, so if anybody sees anything or has information, does it matter where the information? Like, is it in Quebec? Is it in Ontario? Where?
No, for me it does not matter, seeing as this is an increasing problem, not just here but everywhere. I like the information anywhere is fine for me.
Okay, so what kind of information are you looking for when you say you're looking for anything? Like it can be what? Moose spottings, or how is that?
So I'm asking for, if you've seen a moose sightings, if it's tick infested or not, it doesn't have to be. I am also looking for possible moose yarding areas if you know where there's some are. If you've recently shot a moose, go hunting. If you see like a calf with a cow, or any information at all, general information is what I need.
Okay, well that's very interesting. So any viewers out there, you can contact Casey McLaren on anything related to moose. So how would they be able to get in touch with you?
You can contact me at the Land Management and Resources Office here at kebaowek First Nation.
And the number is?
819-67-3309.
Perfect. Thank you very much, Casey.
Thank you.
So hi, Kim.
Hi. Nice to see you.
Yeah, nice to see you too. So I'm here with Kim Chevier, and can you explain to us what your booth is?
I'm going to end up having to turn around.
Okay.
Okay, so I'm the is this okay? Yeah. So I'm the comprehensive community planner for Kebaowek First Nation. It's a pilot project that started in 2017, and what we are basically doing is developing a long-term plan for our First Nation, and it's basically coming from the community. So what I do is I engage community in different workshops, different functions, meetings, and we come together and we're trying to make a decision on the direction of our First Nation. So it's basically going to be a tool for change, so it's going to help us solve problems and challenges, as well as achieve different goals and aspirations. So certain goals and aspirations might be for empowering our community, coordinating for future development. We're also going to be doing some protection of resources, celebrating our culture and tradition, creating economic opportunities, improving performance, as well as supporting teamwork and capacity and local capacity. So what I've done here, you'll see there's a little board here, and we say, why are we planning? Well, we're planning for our children, we're planning for our elders, we're planning for everyone in the community in between. We're looking at trying to protect our environment. We're looking at enhancing skills within the community, looking at volunteerism. So it's basically a community-driven project that is going to help us achieve a better future for our community members.
Wow, so that's it's been a ongoing project for you. So what do you have here at your booth?
Okay, so today what I was proposing to do was to try and create a baseline for reporting. So we want to make sure that there's actually a reported mechanism that's out there so that I can do the same survey next year with the community to see if there's actually been any movement shifts within the CCP process itself. So basically it's just creating a baseline. It's a 7-question questionnaire, and we're hoping that to get as many questionnaires done so that we can have a better reflection of how the CCP process is actually moving forward.
Have you had a lot of input today?
I would say, I'm going to clarify that it's kebaowek members who are filling out the survey only. And having said that, I think I'm at about 75 members who filled out the survey for today.
Wow, that's, I think, is a really good opportunity here to get the feedback from the community.
Yes, I think that's one of the most important things in planning for our community. We kind of look at the whole spectrum of it, and if it's not coming from the community, then sometimes, you know what, it's not our needs aren't necessarily being met. So that's one of the things that we stress within the community is if you want to see change, you have to participate. So having that community engagement is key to making sure that we have a plan that's developed by the community, owned by the community, and it's the community's voice.
That's very good. Well, I want to thank you very much for taking the time to talk to us.
Thank you very much. Have a great day.
You too. Okay, so I'm here with Terry Perrier and Blake Jolly and Tyler Down. And these guys, well, Terry, we'll start off with you. What is your role at Kebaowek First Nation?
I'm the Director of Public Works and Community Infrastructure.
And Blake, what do you do?
I'm a laborer for Public Works.
And Tyler, you'll have to come a little bit closer. My arm is can't stretch that long.
I am a water operator and wastewater operator for the weekends, and I'll be part-time for this as well.
And I was like that, I'll be full-time at this as well.
So you're going to be full-time too, doing what exactly, Blake?
Running the eco center, making sure everything's organized and properly disposed of and taken care of properly.
So, we'll start with you, Terry. So what is your goal here to have this table at the health fair?
Well, the goal today, was to get out awareness of the eco center and how to inform and train people to properly sort everything that goes at an eco center. What can go there versus what goes in your blue box or your green box. Garbage up here, green is garbage, but that'll change too because we're going to be doing composting. So we're going to try and switch our colors around as black for garbage, green for compost, just so there's no confusion with our neighbors.
Okay, so the Eco Center is actually a new project for the reserve here, right?
Yes, the Eco Center and the composting platform.
Okay, so you're looking at starting this when?
It'll be completed hopefully sometime mid-summer.
So now today, even for me, like, you know, when you're talking about like recycling, what goes into recycling? And my dilemma all the time is plastic. Where does that go?
Well, most plastics can go in your recycle bin, but there's some that aren't. And they all have codes on them too, just like styrofoams and stuff. And you need to look at that. And it's different. Some places they'll accept a 6, some won't. So you have to find out what's acceptable within your eco center and for your recycle bin. Like right now, all the recycling for all of us goes up to FOB, near FOB or Bayarn, I forget which one they call it. So they're the ones who I call to find out what we can put in there in the recycle bin.
Okay, so the one on the reserve now, you're going to have one right here on the reserve in the community, right?
Yes, but there's a difference between the recycling and the eco center. The eco center is everything that cannot go in your recycle bin.
Big objects.
Big objects, and like you're not supposed to throw metals in your recycle bin. You're supposed to take them to your eco center. So I know a lot of people don't, and then the recycle place gets full of, instead of plastics and papers and stuff that's supposed to be recycled, they get metal in there and they got to sort it out. That's why they have these big sorting centers using magnets and air to blow stuff out. An eco center is where you're supposed to bring that stuff, not go in your recycle bin.
Okay, so we're going to have our own under reserve, so people can. What's the hours going to be like?
It's not set, but it's definitely going to be better than the access we have to the Kippawa one now, which our community pays Kippawa to use theirs, and they're open on Saturdays, I think, from 10 till 4. But you know, most of our people, we're gone to our camps on a weekend. And we want to have a center that's going to have some days during the week, some evenings, and then also hours on a weekend.
Okay, so people can go there. So what if people don't have like a truck? Is there someone that's going to be available? Like, will Blake come around picking up our stuff if we call him?
No, that's the garbage pickup will still remain your garbage pickup with our truck and everything. But if you have large items you cannot get there, you call Public Works, call myself, and I can arrange to help assist you or just go there, depending on who you are. I don't want to be doing stuff for people who are fully capable, just don't want to do it. I want to be there to help people who cannot do it for themselves.
Okay, so like the elders, for example.
Yes.
So is there any other message you want to like share with the public about this?
Well, it's all about, environment. You have the people over here ahead of us, they're all about environment. We want to work with them. We want to make sure that people are not leaving stuff that contaminate our community and our environment outside of our boundaries. You don't want stuff going in the lake, you don't want stuff going in the ground. And this is how we can best do it nowadays. Don't throw out your fluorescent bulbs, they're full of mercury. Don't throw out old oil. You can take that all up to the Eco Center, we'll dispose of it properly.
Well, that's very good and it's very informative. And are you going to have future information sessions?
Yes, and it'll be handled by these two gentlemen. They're being trained in communication and in operations. So the communication, we're going to have a push throughout the summer to inform people and give them the information they need to properly sort everything and put stuff in your recycle bin, in your garbage bin, and what can't go in there and what has to come up to the center. We're going to do that throughout the summer, and then after that, when we're in operation, it's ongoing because you know how people tend to forget, and you have to keep having activities, reminders throughout the year.
Okay, well, thank you, and I wish you good luck with the project.
Thank you.
Welcome, and I'm here with Kebaowek First Nation Police. So I'll let you present yourselves to our viewers.
Hi, I'm Nellie Mathias. I'm the Chief of Police for Kebaowek.
I'm Marc-André Pelcha. I'm the new officer of the Kebaowek Police Force.
Okay, so you're here at the Health Center Fair. So what is your goal today?
We're talking about recruitment. We're trying to recruit our Native police officers.
Okay, so have you had any success?
No.
Yeah, it's kind of hard, eh? Yeah. So what is other than recruiting, are you handing out any information? Or?
Yes, I'm handing out information on the basic training for the program in Nicolette, what's required for a person who is interested in becoming a police officer. And we're doing a little bit of prevention on the side with keychains. Don't drive high, which is the cannabis law that coming out.
Okay. So that, I guess, is challenging for you guys. Eh?
Yes, it is.
So anyway, I don't know if you have any message that you want to share with our viewers coming from our police station, our police force here.
Just basically be careful when you drive. Don't drive high. Don't drink and drive. And if you're interested in becoming a police officer, to submit your application.
Okay, thank you very much.
You're welcome.
Bienvenue, on est à notre dernière table de la journée à la foire de Kebaowek. Fait que ici avec moi, je vais laisser ces deux se présenter.
Nellie Mathias, chef de police de Kebaowek.
Moi, c'est Marc-André Pelcha. J'ai été nouvellement engagé là, cette semaine pour le corps de police de Kebaowek.
Bon, t'es nouveau cette semaine. Wow! Même pas une semaine.
Ici, non. Ouais, c'est ma première semaine. Là.
OK. Fait que là, votre but aujourd'hui, c'était quoi?
Ouais, c'est vraiment de recruter et faire de la prévention là, auprès de la population là, sur la conduite avec les capacités affaiblies, puis de redonner un peu les petits cadeaux à la population. Là.
OK. Est-ce que vous avez eu beaucoup de monde qui a comme mis leur nombre d'être policier?
Pas beaucoup de monde qui ont manifesté l'intérêt d'être policier, mais on a quand même eu l'occasion de parler avec beaucoup de gens puis de se procurer un peu de faire de la sensibilisation avec la population.
Puis, est-ce que vous avez des défis tant que policier sur la réserve?
Bien, c'est sûr, ça fait pas longtemps que je suis ici, fait que je peux pas vraiment répondre sur les problématiques de la réserve, là, mais Je dirais que la police dans une communauté autochtone, c'est vraiment plus de la police de proximité pour créer une bonne relation avec les gens puis mieux intervenir en cas de besoin.
OK. Fait que là, quel genre de message que tu peux passer à nos viewers, là, comme on dit, là, à propos de la police?
Bien, s'il y en a qui sont intéressés, ils peuvent toujours venir nous soumettre leur candidature. Mme Mathias va s'occuper de ça. Puis sinon, c'est vraiment d'être prudent au volant puis de nous appeler si quoi que ce soit.
Bien, merci d'avoir pris le temps de nous parler. Bonne journée.
First of all, I want to, on behalf of the Health Center and the entire staff, I want to thank everyone for joining us in our annual spring fair. I want to thank our partners. This year we shared the stage with some very important partners that help us in our mandate to have a healthier community. Stem Cell, Emma Quebec for stem cell and blood donor. Neighbors, who is also going to be an important player in the role of helping us access services in an environment where perhaps language is an issue. This is that who is our primary secondary health care provider and also a partner because they're there to help improve the services. We had the complaints commissioner there with us and who's always there to help improve the services. We have also the FNQL HSSC, First Nations of Quebec and Labrador Health and Social Services Commission. They'll say a few words afterwards about the surveys we do. And basically the departments that help us in our way of ensuring health in a holistic manner, land management without good lands and resources. I mean, it's an important part of who we are. Our community planning, our public security. Thank you very much for joining us once again. And we've even included our new project with the Eco Center. So we're very proud, and I'd like to give you all a round of applause. The other project that I cannot forget is our project on Nimiki. Again, it means thunder in Algonquin. It means for us a possibility, many possibilities. It's a great partnership we have now that is inclusive with the mayors of our county, and we're very pleased to have some mayors with us here today. And if you just mind standing up, les élus, the elected people who are helping us out here. This shows a unique partnership. This type of stuff is not built overnight. It takes time. However, a lot of people who pass by the booth understand the importance of it, and that in the future there will be a lot more discussions about this important project. Moving forward, I think I'll pass the mic to Chief Heyman.
Thank you very much. Again, I'd like to thank all of the members for coming out and supporting the activities, and I'd also like to acknowledge, David as the health director in terms of the work that he's done in getting his team organized, in particular to have this event and bringing in all the groups. I do want to thank the mayors for coming down and spending time and helping us promote a project, which is one of the key priorities for us moving forward. With that, I have the distinct pleasure this evening of announcing who kebaowek's Personality of the Year is. As you may have been aware, there was a call for nominations, and so as Chief, I had the great fortune to have the honors of recognizing our Personality of the Year. But before I would do that, I would like to read the nomination letter that was submitted on behalf of our Personality of the Year, and it is Jamie Lee McKenzie. So I'd like to read her nomination letter because it clearly articulates, the work, the effort, the passion that this young lady has put in to getting to where she is.
and it's really an honor for me as chief to recognize her as a role model, and with what she's accomplished. It's simply a matter of, if you have a dream and you have the bravery to follow that dream, you can be successful. I think for me it's clear that's the message I'd like to transmit, but it's really important to understand how and what this young lady has done to be our personality of the year, and I think it's important that we all have a chance. So the letter of support and the nomination was done by her mom. I'm nominating my daughter, Jamie Lee McKenzie, for the 2019 Inspirational Aboriginal Woman of the Year Award. I'm very proud of her accomplishments and believe she should be recognized for her determination, hard work that she has put into achieving her dreams. Jamie Lee graduated from high school in 2007 and then graduated from Canadore College with a diploma in Community and Justice Services in 2009. In 2011, Jamie decided to continue with her education at Nipissing University, and in 2015 received a degree of honors, Bachelor's of Arts specialization in political science and major in Native Studies. Jamie Lee then decided to pursue her true passion of writing and was accepted at Western University in London, Ontario for Masters of Media and Journalism and Communications, graduating with a master's degree in 2017. Upon graduation from Western, Jamie Lee accepted a 3-month internship at the Yukon Human Rights Commission and Yukon News, and made the brave move across the country to Whitehorse, Yukon. Completing her internship, Jamie Lee accepted a small 1-month reporter contract at CBC North, Yukon on July 31st, 2017, which was extended for another 4-month period. In December 2018, she accepted an associate producer position at CBC Manitoba, and in January 2018 moved from the Yukon to Winnipeg, Manitoba, living and working in Winnipeg for a year. Jamie Lee then transferred to CBC Sudbury and started her new position as reporter editor on January 3rd, 2019. It's still where she's currently employed. In previous years, Jamie Lee has always been an active member within the community. In 2012, she was president and spokesperson for the Young and Proud Youth Committee and remained in that position until the group disbanded in 2014. Over the years, Jamie Lee volunteered her time on many different levels within the community and continues to do so by offering to help where she can, when she can, and when she's home to visit. Jamie Lee has aspired to follow her dreams through the encouragement and support of her family, and also through her own hard work and determination. She worked hard to keep a high grade point average throughout her schooling, which awarded her a few bursaries, and most of the time she held 1 or 2 jobs to help cover the cost of living while attending school. I am proud of Jamie Lee's accomplishments during school and her career, as well as her courage to leave the community and venture out into the world. She is a smart and bright young woman with much respect for her community and Native roots, and I believe she's a role model for our younger youth by showing them that they too can achieve their dreams. And I want to echo those sentiments. I've seen this young lady work in multiple positions in our office, and she's always did the best she can. And for me, striking out and having the courage to leave, to follow your dreams, I wish, every one of us, had that same fortitude and courage to do so. And with that, I'd like to invite Jamie Lee up and recognize her as our kebaowek Woman Personality of the Year.
I'm not really used to everybody I'm talking to looking back at me. Normally I'm in a booth hidden by a microphone. But I just want to say thank you. I'm honored to be named as Kebaowek First Nations Inspirational Woman of the Year. You know, I've worked really hard over these years to get where I am today, and I never really thought about myself as an inspiration. But I'm honored and humbled to think that my achievements could inspire even just one young Indigenous woman to follow their dreams. But in the end, I couldn't have done everything that I've done without the support from so many of you in the community. And I especially want to thank my mom. Thank you for that beautiful letter, and thank you for nominating me. Both my parents have always supported me through everything that I've done. They've always believed in me and told me that I could do anything that I wanted to do as long as I tried. No matter what my dreams were, they were always standing beside me. I've always had a lot of pride in my community. And when people ask me where I'm from, I say it proudly, I'm from Kebaowek First Nation. So it makes me really happy and so proud to see that we're recognizing the hard work and achievements of our people. Thank you.